Hi, Jennifer here from Indiana State University studying for my BSN. I've been an LPN for over 20 years, and I'd like to take some time today to talk about a very controversial subject of childhood immunizations. Please note that there will be a link to a pre and a post test, just a little trivia just to have some fun, testing your knowledge to see what you know about vaccinations, because this is controversial. There are a lot of anti-vaxxers out there and parents that don't believe in the safety or the efficacy of immunizations. And I would challenge you to do some research because there's plenty of research out there to debunk all of the myths that these immunizations have baby parts in them or preservatives that are unsafe, that cause autism. And I will say that yes, there are preservatives in vaccinations, just like there are preservatives in our food. Okay, so please, I encourage you to do research on the safety of these immunizations because there are a lot of things out there and sicknesses, diseases that could have been prevented through these immunizations. And also you will see a link that pops up to a cheat sheet that I have made for myself that I wanted to share with you. It's just a little guide to help know which vaccination to give at what age. In my 20 years of nursing, I have given many, many vaccinations. And I will say that it's not my favorite part of the job, but I do understand the importance of it to the community. So I encourage you to do research. Today we're going to talk about the actual vaccines and what it is they prevent. Hepatitis B, that's given at birth. If you look at all of the baby boomers nowadays that are battling with hepatitis B, it's very, very sad that they didn't have this vaccine out when they were born because they wouldn't have to even deal with this situation that causes liver cancer and liver damage, a lot of sickness with hepatitis B. So thankfully, the up-and-coming generation, they are getting vaccinated at birth, and then they get vaccinated, it's a total of 3 doses. They get vaccinated 2 months apart. And it can actually be given at any point in life, but it is given at birth. Rotavirus. Now, this causes diarrhea and severe dehydration. It is given at 2, 4, and 6 months. A child that is 8 months and older, we don't even give it to. If they've gotten past 8 months, we don't even worry about it because this is a virus that really attacks infants. So over 8 months, we don't even give it. This is the important one. This is DTaP, diphtheria, tetanus, and pertussis. Diphtheria causes breathing issues, heart failure, paralysis. Tetanus causes extreme tightening of the muscles and even lockjaw. But pertussis, now this can be fatal, but it also causes seizures, pneumonia, brain damage. So this is a combination vaccine that is wonderful because instead of having to poke the child 3 times, you only have to poke them once with this combination vaccine. Now, this vaccination is mandatory for children to get into school. Polio has been eradicated here in the United States, and this is to the thanks of vaccinations. So it's very important that we continue on this same trend and continue to vaccinate for polio because it does cause permanent limb disability or paralysis and difficulty breathing. You know, we've all seen the older people that are on crutches and disabled because of polio. And thankfully, this is not something that our children have to deal with. Hib, that's short for Haemophilus influenza type B. This causes infection in the sinuses, in the ears, in the heart, the blood, the bones, the joints. You can get really sick with this. So it's a very good idea to get vaccinated. And this is given at 2, 4, and 15 months of age. Pneumococcal. This prevents pneumonia, infection in the ears, the sinuses, the brain, the spinal cord, and in the blood. People can get very, very sick with this. So it's a good idea to prevent it altogether and just get vaccinated. Now, this vaccination is given in childhood as well as adulthood. Varicella, better known as chickenpox. This creates a rash, and if it's scratched too badly, it can even go into a skin infection. It can cause pneumonia. It can cause brain and blood vessel swelling, bone and bloodstream infections. So this is a whole lot more than just a rash. You know, people can get very, very sick with this. And this one too is also mandatory to get into school. MMR, measles, mumps, and rubella. What does measles do? It causes the rash. We all know about the measles rash. However, it can go so much worse than that. It can cause cough, ear infections, fever, pneumonia, diarrhea, and this can actually be fatal. And it can cause brain damage too. Mumps, this causes swelling of the brain or the spinal cord, swelling in the ovaries or testicles, and even possibly death. Rubella, this can cause that rash again, sore throat, headache, arthritis. However, if a woman is pregnant and they get rubella, it can actually cause a miscarriage. And this vaccine is also mandatory for the schools. Meningitis or meningococcal. This is an infection in the brain and in the spinal cord, and there are many children that have died from this. This is no joke. This is very important to get vaccinated against. This is also mandatory to get into the schools, and usually this is given at the ages of 11 and 16. That's the current recommendations to give this. Now, there is also another strain of meningitis that we now have a vaccination for. Now, this meningitis is mandatory for school, but the other strain, which is meningococcal B, that is still optional, but it is, again, encouraged to be given to protect against that. HPV, or the human papillomavirus. This causes genital warts and cancer. Very, very important to get vaccinated. Now, there is a little catch with this one. Whenever we give this one in the office, we always have the child sit for a good 15 minutes to a half an hour to make sure that they don't have an adverse reaction, because this vaccine has been known to cause children to faint. So again, this is one that we definitely want to watch over. Now, all of the other vaccinations, of course, there's possible side effects to anything. There's possible side effects to vaccinations, to food, to lotions, to perfumes. There's always a possibility for a side effect, and it's to be expected that the child will be a little bit cranky, maybe a little bit grumpy. But again, this HPV is the one that we definitely watch for after we give it. Hepatitis A. At this point, hepatitis A is not mandatory, it is optional. Hepatitis A causes liver damage, but hepatitis A is found in contaminated food and contaminated drinks, and we eat out a lot. So it's very important to protect your child against this. This is a 2-dose series. It can be given at All of this information was taken from the Southern Illinois School of Medicine and their training manual. Again, I encourage you to look for more information on the CDC website, the World Health Organization, and they too will have a list of what vaccinations are due at what age. Thank you so much for listening today, and I hope you have a great day. Bye-bye.